Question 16. A male client with a history of cirrhosis and alcoholism is admitted with severe dyspnea resulting from ascites. The nurse should be aware that the ascites is most likely the result of increased A. Pressure in the portal vein, B. Production of serum albumin, C. Secretion of bile salts, D. Interstitial osmotic pressure. Correct answer, A. Pressure in the portal vein. Question 16. Explanation. Enlarged cirrhotic liver impinges the portal system, causing increased hydrostatic pressure resulting in ascites. Portal pressure increases above a critical threshold and circulating nitric oxide levels increase, leading to vasodilation. As the state of vasodilatation becomes worse, the plasma levels of vasoconstrictor sodium retentive hormones elevate, renal function declines, and acidic fluid forms, resulting in hepatic decompensation. Question 17. A newly admitted client diagnosed with Hodgkin's disease undergoes an excisional cervical lymph node biopsy under local anesthesia. What does the nurse assess first after the procedure? A. Vital signs, B. Incision site, C. Airway, D. Level of consciousness. Correct answer, C. Airway. Question 17. Explanation. Assessing for an open airway is the priority. The procedure involves the neck. The anesthesia may have affected the swallowing reflex, or the inflammation may have closed in on the airway, leading to ineffective air exchange. When the numbness wears off, the throat may feel scratchy for several days. After the test, the cough reflex will return in 1 to 2 hours. Then the client may eat and drink normally. Question 18. A client has 15% blood loss. Which of the following nursing assessment findings indicates hypovolemic shock? A. Systolic blood pressure less than 90 mm Hg. B. Pupils unequally dilated. C. Respiratory rate of 4 breath per minute. D. Pulse rate less than 60 beats per minute. Correct answer, A. Systolic blood pressure less than 90 mm Hg. Question 18. Explanation. Typical signs and symptoms of hypovolemic shock include systolic blood pressure of less than 90 mm Hg. The first changes in vital signs seen in hypovolemic shock include an increase in diastolic blood pressure with narrowed pulse pressure. As volume status continues to decrease, systolic blood pressure drops. As a result, oxygen delivery to vital organs is unable to meet oxygen demand. Question 19. Nurse Lucy is planning to give preoperative teaching to a client who will be undergoing rhinoplasty. Which of the following should be included? A. Results of the surgery will be immediately noticeable postoperatively. B. Normal saline nose drops will need to be administered preoperatively. C. After surgery, nasal packing will be in place 8 to 10 days. D. Aspirin-containing medications should not be taken 14 days before surgery. Correct answer, D. Aspirin-containing medications should not be taken 14 days before surgery. Question 19. Explanation. Aspirin-containing medications should not be taken 14 days before surgery to decrease the risk of bleeding. Impaired coagulation may cause postoperative complications. Patients should be asked about a history of excessive bruising or bleeding, consumption of drugs, supplements, or vitamins that alter coagulation cascade, or history of thrombotic events in the past. Any drug, vitamins, or supplement that impairs coagulation might have to be suspended preoperatively. Question 20. Paul is admitted to the hospital due to metabolic acidosis caused by diabetic ketoacidosis, DKA. The nurse prepares which of the following medications as an initial treatment for this problem? A. Regular insulin. B. Potassium. C. Sodium bicarbonate. D. Calcium gluconate. Question 18. A client has 15% blood loss. Which of the following nursing assessment findings indicates hypovolemic shock? A. Systolic blood pressure less than 90 mm Hg. B. Pupils unequally dilated. C. Respiratory rate of 4 breath per minute. D. Pulse rate less than 60 beats per minute. Question 21. Dr. Marquez tells a client that an increased intake of foods that are rich in vitamin E and beta-carotene are important for healthier skin. The nurse teaches the client that excellent food sources of both of these substances are: A. Fish and fruit jam. B. Oranges and grapefruit. C. Carrots and potatoes. D. Spinach and mangoes. Correct answer, D. Spinach and mangoes. Question 21 Explanation. Beta-carotene and vitamin E are antioxidants which help to inhibit oxidation. Vitamin E is found in the following foods: wheat germ, corn, nuts, seeds, olives, spinach, asparagus and other green leafy vegetables. Food sources of beta-carotene include dark green vegetables, carrots, mangoes and tomatoes. Question 22. A client has gastroesophageal reflux disease, GERD. The nurse should teach the client that after every meal, the client should A. Rest in a sitting position. B. Take a short walk. C. Drink plenty of water. D. Lie down at least 30 minutes. Correct answer, A. Rest in a sitting position. Question 22 Explanation. Gravity speeds up digestion and prevents reflux of stomach contents into the esophagus. Instruct to remain in an upright position at least 2 hours after meals, avoiding eating 3 hours before bedtime. Helps control reflux and causes less irritation from reflux action into the esophagus. Question 18. A client has 15% blood loss. Which of the following nursing assessment findings indicates hypovolemic shock? A. Systolic blood pressure less than 90 mm Hg. B. Pupils unequally dilated. Correct answer, B. Abdominal distension. Question 23 Explanation. Abdominal distension may be associated with pain, may indicate perforation, a complication that could lead to peritonitis. Bowel perforation occurs in less than 0.3% of cases, and infection is rarely reported. Complications typically are identified in the first 24 hours after the procedure. Perforation is identified due to fever, tachycardia, abdominal pain or discomfort. Question 24. A client who has undergone a cholecystectomy asks the nurse whether there are any dietary restrictions that must be followed. Nurse Hilary would recognize that the dietary teaching was well understood when the client tells a family member that A. Most people need to eat a high-protein diet for 12 months after surgery. B. I should not eat those foods that upset me before the surgery. C. I should avoid fatty foods as long as I live. D. Most people can tolerate regular diet after this type of surgery. Correct answer, D. Most people can tolerate regular diet after this type of surgery. Question 24 Explanation. It may take 4 to 6 months to eat anything, but most people can eat anything they want. Start with clear liquids after the surgery to prevent nausea, vomiting, and constipation, soup, jello, juices, popsicles, and carbonated beverages, then advance to a regular low-fat diet. Eat smaller meals more often instead of fewer larger meals. Correct answer, A. Rest in a sitting position. Question 22 Explanation. Gravity speeds up digestion and prevents reflux of stomach contents into the esophagus. Instruct to remain in an upright position at least 2 hours after meals, avoiding eating 3 hours before bedtime. Helps control reflux and correct answer, D. Clay-colored stools. Question 25 Explanation. Clay-colored stools are indicative of hepatic obstruction. Acute HAV infection is typically a self-limited illness characterized by nausea, vomiting, right upper quadrant abdominal discomfort, malaise, anorexia, myalgia, fatigue, and fever. Patients may develop dark urine and pale stools within a week, followed by jaundice, icteric, yellow-tinted, sclera, and pruritus. Question 26. Which of the following anti-tuberculosis drugs can damage the 8th cranial nerve? A. Isoniazid. B. Para-aminosalicylic acid. C. Ethambutol hydrochloride, myambutal. D. Streptomycin. Question 19. Nurse Lucy is planning to give preoperative teaching to a client who will be undergoing rhinoplasty. Which of the following should be included? A. Results of the surgery will be immediately noticeable postoperatively. B. Normal saline nose drops will need to be administered preoperatively. C. After surgery, nasal packing will be in place 8 to 10 days. D. Aspirin-containing medications should not be taken 14 days before surgery. Question 27. The client asks Nurse Annie the causes of peptic ulcer. Nurse Annie responds that recent research indicates that peptic ulcers are the result of which of the following? A. Genetic defect in gastric mucosa. B. Stress. C. Diet high in fat. D. Helicobacter pylori infection. Correct answer, D. Helicobacter pylori infection. Question 27 Explanation. Most peptic ulcers are caused by Helicobacter pylori, which is a gram-negative bacterium. H. pylorus is a gram-negative bacillus that is found within the gastric epithelial cells. This bacterium is responsible for 90% of duodenal ulcers and 70% to 90% of gastric ulcers. H. pylori infection is more prevalent among those with lower socioeconomic status and is commonly acquired during childhood. The organism has a wide spectrum of virulence factors, allowing it to adhere to and inflame the gastric mucosa. This results in hypochlorhydria or achlorhydria, leading to gastric ulceration. Correct answer, D. Most people can tolerate regular diet after this type of surgery. Question 24 Explanation. It may take 4 to 6 months to eat anything, but most people can eat anything they want. Start with clear liquids after the surgery to prevent nausea, vomiting. Correct answer, D. Dark brown. Question 28 Explanation. 12 to 24 hours after subtotal gastrectomy, gastric drainage is normally brown, which indicates digested food. Assess color, amount, and odor of gastric drainage, noting any changes in these parameters or the presence of clots or bright bleeding. Initial drainage is bright red. It becomes dark, then clear or greenish yellow over the first 2 to 3 days. A change in the color, amount, or odor may indicate a complication such as hemorrhage, intestinal obstruction, or infection. Question 29. Nurse Joan is assigned to come for a client who has just undergone eye surgery. Nurse Joan plans to teach the client activities that are permitted during the postoperative period. Which of the following is best recommended for the client? A. Watching circus. B. Bending over. C. Watching TV. D. Lifting objects. Correct answer, C. Watching TV. Question 29 Explanation. Watching TV is permissible because the eye does not need to move rapidly with this activity, and it does not increase intraocular pressure. Once the patient gets home, it is recommended that they rest their eyes and nap. Several hours post-surgery, most people are able to watch some television or look at a computer screen for a short period of time. Because cataract surgery is only performed on one eye at a time, the patient may notice an imbalance in the vision until the second eye is operated on, usually 1 to 4 weeks later. Question 30. A client suffered from a lower leg injury and seeks treatment in the emergency room. There is a prominent deformity to the lower aspect of the leg, and the injured leg appears shorter than the other leg. The affected leg is painful, swollen and beginning to become ecchymotic. The nurse interprets that the client is experiencing A. Fracture, B. Strain, C. Sprain, D. Contusion. Correct answer, A. Fracture. Question 30 Explanation. Common signs and symptoms of fracture include pain, deformity, shortening of the extremity, crepitus and swelling. These injuries are associated with symptoms of pain, deformity, swelling, and a wound that may be bleeding. It should be noted that the wound may not lie directly over the fracture site. The movement and neurovascular status of all involved limbs should be assessed to ascertain whether or not there is a possible nerve or vascular injury associated with the fracture.